Hi, my name is Erin Odell, and I'm a nursing student at Western Governors University. I'm also a full-time registered nurse at Harborview Medical Center in Seattle, Washington. I'm here to talk about catheter-associated urinary tract infection, or CAUTI, as we like to refer to it. The reason I chose this topic is because I wanted to educate myself on best practice, as well as to be able to educate my coworkers. The central idea of this presentation is to provide information that can lead the way to a decreased incidence of CAUTI, and a nurse-driven protocol is key because it allows the nurse to evaluate and question catheter use in the setting of a best practice guidelines. In best practice, CAUTI is nationally recognized. Nurses at bedside are in a position to monitor closely the catheter use, and this is really significant. The American Nurses Association has now indicated that it should be a nursing-sensitive measure in evaluating nursing care and nursing interventions. CAUTI is the most common of all hospital-acquired infections. It's very preventable, and according to Mori, nurse-driven protocols can enable the nurse to evaluate and deem the appropriateness of catheter use to remove the catheter when necessary, all in accordance with best practice guidelines. And so several studies have shown and support that a nurse-driven protocol to follow best practices for urinary catheter use is important because, number one, we can reduce the rate of infection of CAUTI in the hospital, and number two, that the cost can also be reduced as a result. So to discuss the first point, a nurse-driven protocol is going to help reduce the rate of CAUTI. According to Mori, about half of the patients who receive a catheter in one study have no indication at all for its insertion. And in the same study, nearly half, about 40% of doctors were unaware that their patients even had a catheter. And so kind of a big deal, at least that the incidence or the prevalence of catheters is being missed. In another study, there was a meta-analysis done of over 30 different studies, and this was done by Meddings and different colleagues, that showed the implementation of a nursing-driven protocol reduced the incidence of CAUTI by 50%. Meddings and colleagues also states in this same in their same journal article that to remove a catheter is a 4-step, very lengthy process, and to implement a nurse-driven protocol, can reduce that time that an unnecessary catheter remains in place. It reduces the time by a lot. In the second part of the thesis, I said that reducing the incidence of a CAUTI, the nurse-driven protocol can help reduce the cost of hospital-acquired infection. Now, 2 facts that I pulled from the research that I've done is that, according to Olson, Sitke, and Forbes, about 70 to 80% of urinary tract infections have been traced to urinary catheters. And every day, that risk will increase 5% that the catheter remains in place. So Mori also states that CAUTI affects mortality and increases days hospitalized. Yearly costs exceed $400 million for healthcare, and Medicare no longer reimburses for CAUTI-associated hospital-acquired infection. This is an example of a nurse-driven protocol that was given to me at Harborview Hospital. We implemented this in July of 2015. I credit Erin Odell for the design. She's manning the program to implement a nurse-driven protocol at Harborview Medical Center. So according to the pathways, if they're followed correctly, it will lead the nurse to evaluate whether the catheter needs to come out or is appropriate. Down here, appropriate indications for catheter use. And basically, it goes off of a bladder bundle that we've already had in place. It just has a few other added things like a standing order to remove the catheter if deemed so necessary by the pathways that we follow. So that's Erin Odell. Okay. So in summary, this information helps nurses to use best practice and understand the importance of our lowering the incidence of CAUTI and the costs in effect. So in doing so, the patient outcomes and patient satisfaction can also be improved in a positive way. In conclusion, multiple studies show support of a nurse-driven protocol to reduce the rate of catheter-associated urinary tract infections and improve the cost burden of this hospital-acquired infection. Evidence-based practice is key for the nursing role of preventing CAUTI. And that concludes the end of my presentation. If there's any questions, please let me know, and I'll be happy to answer anything you have for me. Thank you.